Yeah, and that's an excellent point because a lot of folks think AI is making decisions for providers. I mean, in my opinion, there's a couple of things that are always going to require human intervention, and by human intervention I mean empathy, right? Love and medicine. I think in order to have a relationship with another human being and have that empathy, it needs to be a person to person. Some people may disagree with me, and also from a medicine perspective, I think it's the same thing. You want a doctor that is going to have empathy. You want a human being. Now, that doesn't mean that in the future, 70-80% of the use cases in medicine, especially those annual checkups or routine tests, cannot be done automatically. But when there are symptoms, when there does need to be treated, you do need a human, right? And that you need their judgment, and they need to be able to explore all the possibilities. So, to your point, and it's a very good one. The AI is not telling you what it is. They're telling you all the possible options that you should consider and why you should consider them. And then you can communicate with the AI and present more information or ask questions to help you qualify in the context of the patient's data. So it becomes almost like a brainstorming session. It's almost like if you had Socrates, the first doctor, and he knew everything about everything, and he knew everything about this patient, and you could have him next to you 24/7, and you could say, hey, patient A, what do you think is going on here? What are the possible diagnoses? And he can say, listen, I don't know for sure, but it sounds like it could be one of these 8, 9 things. Let's go through them. By the way, let me ask you a few questions about it so I can help you qualify which one to look at first. Right? It's not a deterministic approach. It's not going to tell you it's this, do that. It's going to tell you these are the things, and then the exchange of ideas, the conversation starts. And so that's really the way to think about the augmentation side of this. AI also facilitates on the automation when it's a task that's routine, but we're not talking about that right now. We're talking about clinical decision making that does require that exchange, and it does require human judgment.